Wow. Yeah, we run a little late, but we here. And ready to get the show started. Just getting set up. There we go. Q, I see you in the building, baby. Jasmine, I see you, lady. Y'all got to daughter Penny, you in the house. Y'all got to bear with me today. It's Yay World. I see all y'all coming in. Yes, sir. Come on, come on, come on. Yes, sir. All seasons in the building. Uh-oh. There we go. Ooh. Yeah, y'all.
Hey,
What's going on?
how are you?
I'm good. You're cut off at the neck. You got a lot of headroom.
How can I make this bigger?
Y'all bear with us. We are experiencing technical difficulties. I'm gonna tell y'all a little story after it gets on and popping. Sorry we came on a little late. Cozy, I see you in the building. You know, it's times like this that the devil gets busy. I went to turn on the system. I have no sound. The mic went out, so we doing this old school. Reddick, I see you. AK, Cuz, I see you. But nevertheless, we're gonna do the show. We're here. Y'all just bear with us a little minute. I'm going to let some people get in, and then I gotta pay some bills right quick. But nevertheless, I'm excited about today's show. Can y'all hear me okay, Brooke? You can hear me good?
Yeah, I can hear you.
Okay, cool.
It
Pops
sounds good.
got to be heard. All right. Yeah, y'all see it. I mean, my cameraman didn't show up. The name is backwards. But nevertheless, we're not going to let none of that stop us. We still on the air. And let's get there. There we go. All right. Y'all can see that it's backwards, but that's okay. We'll fix it later. All right. Letting people come in about 8:10. We still in good time. And first and foremost, I want to give a shout out to God, who is the head of my life. Without him, none of this would be possible. I definitely want to acknowledge him. Exotic Pops, Lefty, he was on last week. We're going to shout out to Exotic Pops, Lefty. He coming in a little later. Just call me Lex, I see you. Lakai Holmes, it's the season. Get your candle. Ask for Pop's perspective. They're giving a buy one, get 50% off. She got a whole bunch of specials you can pick from, free delivery, things like that. If I had smell-o-vision, you can smell it burning in the background. Cozy Lifestyle, good friend of mine, always very supportive. We want to shout out to them. They're in the building. Of course, Jay Reynolds, the theme song. Y'all know it. You've heard it. It's the theme song for Pop's Gems, Pop's Perspective. So we shout out to them. And then to my most special supporters is you, and you. All of you who are tuning in and take time. Time is something you can't get back. You donated time and you tuned into the show. So we definitely appreciate that. Matt Will _93, we see you. Shout out to Cuz. And then I want to do something special. And I'm introducing this into the intro of the show. There's somebody out there that's hurting. There's somebody out there that's going through something and you're wearing it and you're heavy. I just pray that the Lord will bless you, will lift that burden. There is hope. There is a positive. There is a light at the end of the tunnel. All is not lost. Be encouraged, because God is not a respecter of persons, and what he does for one, he'll do for others. So I just pray that whatever you're going through, remember I told you there's one of three things. You're either in a storm, coming out of a storm, or you're going into a storm. But wherever you find yourself tonight, if you just need that encouragement, I'm sending out air hugs, as they do, spiritual hugs, and you're definitely on my heart. I mean that. And while I'm in that area, because I know there's a couple people, man, a couple people on here I've been talking to. I ain't gonna put them on blast because it's none of your business, but there's a couple people that are going through some things. And the thing came to my mind, am I my brother's keeper? Well, we're supposed to take care of one another. If you say you're my friend and you see me down, you're supposed to come and encourage me and find out what's going on, if you're really my friend. Yeah, but that's a story for another day. Also, I want to give a special shout out to THA.Riddick. He's watching us all the way from Argentina. Pop's Gems and Pop's Respect of his international. Special shout out to him. Thank you so much. Still working on getting a candle to you. It's coming, don't worry. Or if you ever get back to the States before I send it, we'll bless you with that. So we got a great show coming up. You know, in this season, the reason I picked this show was because statistics will tell us that during this time of the year, people are more prone to get depressed. People are more prone to get suicidal. And it's because of the vicissitudes of life and the pressures that society puts on them that makes them want to, you know, keep up with the Joneses, so they bleed out their bank accounts, or, you know, they don't feel they did enough, so they, you know, they get it, woe is me. But Mr. Moy Brown, I see you. But let me tell y'all something. This time of year, and I know it's a whole show, but don't let the season or the real reason for the season cause you to do something that's not intended for you to do. This is the time that you know, the adversary is busy, and whatever, you know, whatever you want to believe in as far as higher power, things of that nature, but there is good and evil. And so this is when evil wants to steal your joy. It's like a spiritual Grinch, if you will. And so I thought about this show, and the young lady I'm about to introduce, and people still coming in, I'm just giving them a chance coming in. This young lady, I've seen her grow up. Very smart young lady, very humble, very, very humble young lady, very smart, intellectual. You wouldn't know, you wouldn't know it, but she's a mastermind, and of course you're gonna hear her speak. I'm very, very proud of her. She don't call me Pops, but it's kind of like Unc, so kind of along in the same vein. But like I said, I've been knowing her over 20 years, and to see her move into where she's at now is really, really amazing. It makes me feel good. I see you. Banger put them paws in the building. Hands up. That's oh, let me say this, and then I'm gonna bring in my guest. For those of you who are boxing fans, I got a special show coming up. I'm gonna have a special guest who went all the way up to the 2024 Olympics, I believe, and he's been traveling all over the world, knocking people out in the name of Jesus. He's been laying hands, just in a different way. But we're gonna have him. We're gonna have him on the show, and we're gonna do a show about him. But tonight, I just want to talk about mental health awareness from two standpoints. One, from being able to observe when somebody is in a mental health. And mental health is synonymous to physical health in this aspect. When you're not feeling well, and people that are around you, they can say, "You feeling okay? You look like, you know, or you'll have symptoms. You may have a runny nose or a little cough, or, you know, as they say, you're under the weather." Well, mental health is kind of the same thing, because there are telltale signs that if you're keen, and this person, if you're really your brother's keeper, you'll notice these signs. So I said to myself, well, maybe not everybody knows the signs. Maybe not everybody knows what to look for. Or there's people that are in their mental health is not as good as it should be, but they just accept it as a way of life, thinking that there's no other alternative. So the next voice that you're going to hear, super good friend of mine. I'm super proud of her. She's going to introduce herself. And look, this ain't no plaything. She got schooling behind it. She's going to tell you all about that. But y'all turn your attention, scoop a little closer, bring your phones a little closer, turn the volume up. I present to some and introduce to others my good friend, Miss Brooke Bishop. Welcome to the show.
Thank you, Reverend Pratt. Well, Pops,
Okay.
thank you for having me. Thank you for allowing me to have this opportunity to talk about mental health on your Pops perspective future podcast that you're going to have, right?
That's right.
Um, First, I wanted to introduce myself. I am Brooke Bishop. I am a licensed mental health counselor in Florida. I got my bachelor's in Florida Memorial University, which is at HBCU in Miami. And then I went to FAMU to get my master's in clinical counseling and mental health. So that's a little bit about my education background. I did substance abuse, now I'm doing mental health. I did outpatient, now I'm doing residential. So I've been a little bit of both outpatient and inpatient. So I've been doing it since 2018 or 19. So I've been almost, 5 years?
5 years. Five
Yeah.
years in the game, going strong.
Yeah.
Well, good. We're glad to have you. We're so glad that you thought it not robbery, as they say, to spend time with us. Now, for those of you, before we go on, if the name sounds familiar, if you remember 2 shows back, I think it was 2 shows back, we've done so many. No, I'm just kidding. A couple shows back, we had Blair Bishop talking about children nowadays. That is the sister of Brooke Bishop. So she comes from a line, of a professional family. And so if the name rings a bell, this is not this is a different Bishop. This is Brooke. So, Brooke, we thank you again for coming on the show. We want to jump straight into it. What I would like for you to do is share some of the signs that people can be aware of that they observe someone that may be going through a mental health crisis, or if they're feeling down. If somebody was to observe that, what would be the signs that you would look for?
So it's different for everyone, depending on what diagnosis. So if we're looking for like depression, there are like certain signs we look for depression. A lot of them start off with maybe oversleeping, undersleeping, probably feeling hopelessness, probably suicidal. Also a lack of isolating, withdrawing from others. Another one could be um, either not, if they're oversleeping or undersleeping, not eating or eating too much. So it looks different for everyone, but those are some of the signs. Also, feeling guilty, purpose. So those are the signs you look for. But I think for most African Americans, we don't really look at those signs. We look at maybe they're going through a moment, maybe they're just, being themselves and they need some time to themselves. But usually when it happens, depression is like at least 2 weeks or longer when someone's depressed. So if you see those signs longer than 2 weeks, then you probably should check on them or probably like reach out to them.
That's
Cause
a
you,
good angle right there. Hold that
yeah,
camera.
because you can tell in their mood. You'll be able to tell in their mood. Like you'll be able to tell like they're not acting themselves. They're different. How the way they carry themselves. They don't want to hang out with people or isolate. Not getting out of bed. A lot of them struggle getting out of bed, having that motivation. So that's one big thing. Like a lot of them, like they struggle to get out of bed for depression. Like I know we use it out of context all the time. Like I'm depressed.
Mm-hmm.
The real diagnosis of depression is really like it's like the person who like really can't do anything. Like they're
Wow.
mentally like not there.
Okay. So that serves as, and those of you that listen, it's important that you don't just, like, if somebody, they they in their feelings type. That's a common phrase that they use. Oh, leave them alone, they in their feelings. It's a key factor that you pay attention to things like that. Correct me if I'm wrong, because they're in their feelings for a reason. Something has happened, or something that's transpired. I'm reading a book called Psychological Triggers, and I got some special stuff toward the end of the show. But in that book of Psychological Triggers, there's things that if you don't get to know yourself, and events happen, and then you find yourself getting depressed or your temper flares. And if you don't pinpoint it, you won't know that it's a psychological trigger, that something happened that triggered something inside of your past. And so when you see people do it, like she said, that they're slow to get out of bed, they don't want to do nothing. And this is a contrast from they've been running with you before, you know, they've been doing this, that, and the other. They're the first ones to say, let's go, let's go. And then all of a sudden they're not moving like they used to. Don't just say they in their feelings. Check on people, because you never know what a text, a phone call, you know, a FaceTime. They may not, or if you're a big FaceTimer and then they don't want to FaceTime you, that could be a sign. You know, they're afraid or they don't want to interact because of what they're going through. But you know, you can't blame these people, because it's just like people that are sick. You can't get mad at them because they're sick. If you're their friend, you'll help them. You'll bring them the medicine that they need, because you don't want to see your friend sick. I'm just saying. I think I'm on point. I think I'm pretty close to the marker there. So, so it's important that that you watch patterns. A good friend of mine told me about patterns. If you see people that they're consistently doing something, like if they're always calling you in the morning and all of a sudden they stop, notice, pay attention to that, because those are telltale signs when they break patterns that they've established. That somebody's going through something. And I wanted to ask you this, and a lot of people may take it, you know, kind of lightly, but I guess the question is, how serious is it when somebody is slipping into a mental health, I call it mental health sickness, and they're going, what are some of the possibilities of the end result? I mean, of course, we know the end result will be they want to commit suicide, but I mean, what other things would they encounter? I mean, if they don't seek the help.
So, for one, you did mention the suicide, and normally with depression, it leads up to suicide.
Okay.
So that is like one of the biggest things, like suicide. A second one would be like not working anymore. So now they're not working. They're losing like interest in working. Like, right, they're calling out for work or not going to work. Another one would be lack of activity, daily living, which means like personal hygiene will go bad. Not being in a shower, not having the motivation to clean after themselves, not being able to do chores. They lose focus in doing the activity, daily living. So a person may also have not only the activity daily living lacking, but also the suicide ideations or not working. So it's like the one of the three. Either they're lacking in their personal hygiene, they're lacking in not wanting to work, not be able to function, you know, to do the things they need to do on a daily basis, or suicide ideation, or they can have all three. So those three things can be impaired because of the depression. And I know we think that, oh, that's not a big deal, but it is a big deal, because eventually it comes to the point where they don't even have purpose no more to want to live no more.
Wow.
So there are numerous reasons, but those are the three that I see the most with depression, besides the suicidal, yes, but not working and not being able to concentrate or focus, and just lacking on personal hygiene. So some people can go days without showering or days without getting out of bed.
Wow. It affects their appetite as well. Now, that could go either way, right? They can either like eat themselves into oblivion. I'm not talking about me. I eat because I like to eat. I mean, I'm not depressed. Or they can starve themselves. They can lose their appetite, which is not good.
Definitely. Overeat or undereat. It's just different for everyone. Some people overeat and some people undereat. Some people don't eat at all. They'll lose a lot of weight because they're that depressed where they don't eat. So they're in the bed all day. Wow. They're depressed. So they're not thinking about food. They're not thinking about work. They're not thinking about nothing but, you know, the negative thoughts that they're having. Feeling hopeless, you know, not being able to concentrate, difficulties focusing on a task. Just don't have any motivation at all.
Okay. All right. Okay. Now, Lakai Holmes in the building. Yeah, I seen your candle lit when you came in. So that's very valuable information now, and I'm speaking to everybody. Can depression, the reading says, can depression lead to drug abuse? And I guess that would be it. If you want to answer that, I can answer that. I mean, anything that would take you out of reality to take you away from your present situation. If you're that depressed, alcoholism, drug abuse, they're searching for an escape. But the sad thing about it is when you get sober, when you come down from your high, the problem ain't gone nowhere. You got to deal with this. You got to deal with this head on. But some people will, and I've known people that are they'll throw their whole life away. And like you said, they lose their jobs because they don't want to go. They find comfort in drug or alcohol, and then now they're pawning, selling, stealing, doing everything they can to just feed that it's a demon. I call it's a demon. It's an evil spirit. But for those of you, they just feed that urge, because ultimately you're trying to destroy yourself. You don't see it, but you're your own worst enemy. You're trying to destroy yourself. So it's very important that we, as from the outside, look at, and it can go both ways, because when I posted something, I said I'm starting with the man in the mirror. So, if you see yourself falling into any of these habits, you may want to sit down and think, what's going on? Yay, world, I see you. What's going on? What am I going through? Try to get a grip and see, because if you're acting out of the norm, it's for a reason. So it's important that not only do you observe it in other people, but you observe it in yourself. So thank you so much for those points. And of course, the severity of it, depression and mental depression and all that is nothing to play with, is nothing to joke with. And unfortunately, there's people out there that will be cruel. You have to be careful how you treat these people, because you'll push them further off the edge, if you will. And so we don't want to do that. All right, so that's on that end. Now the other aspect would be, what you want to get on the camera on this? What are some things that we can do both personally? It's like, if in again, dealing with the physical health, if you take your vitamins, you walk every day, think that and other to keep your health up. What are some of the mental health exercises that a person can do to avoid from slipping into depression or slipping into a substance abuse or something to that nature?
So, like for mental health, physical, I like to tell everyone to do mindfulness walk. That's like a DBT technique. I know for the people who not know what DBT is, but for dialect behavior therapy, one of the like something physical you can do is mindfulness. So mindfulness means stay in the present, stay in the moment, focus on the here and the now. So someone who wants to be physical, just take mindful walks. So focus on your surroundings, focus on the present, focus on what you see, what you feel, how you hear. So you're training your body, you're training yourself to physically focus on the present moment. Another one would be like self-care. Do things that you know that you enjoy doing. It doesn't have to be expensive. You can do self-care with small little things. Like you can, I know for girls, they can paint their fingernails, or for guys, they can, go boxing, or they can,
Get a haircut.
exercise. So there are little things, or you can, treat yourself and get a haircut, or, it's little things that you want to do. But self-care is all about little things for you. So it's like things that make you feel good, a hot bath, or with candles, or if you're a guy and maybe you want to vent, play the video games, something that that you will have you like calm and relax, something that you enjoy doing. It's like a hobby, but it's therapeutic when you do self-care. So anything self-care for you, like maybe go in the pool, or maybe hang out with some friends and go out to eat. So self-care doesn't have to be something extravagant, but it's all that it matters to you, something that's small, delicate, meaningful. That's what self-care is. Things that you enjoy, your hobbies, your interests. What do you like to do? What makes you happy? What makes you smile? So it's the small little things that actually self-care plays a part in. So it doesn't have to be extravagant. And I think a lot of people think it has to be something big, but self-care is like means the smallest things. You can even go to the spa, or you can take yourself to the, if you don't want to go to the spa, you can do something else. Pamper yourself, do your homemade spa. Or with
Okay.
guys, so it just all depends on what do you want to do. Guys can get pedicures too. I know a couple
Yeah.
guys that I've seen get their feet done. But yeah, or if you like pets, you can go to pet therapy. They have a lot of shelters, a lot of facilities that you can volunteer to pet animals. It's supposed to be like emotional support. So there's like a lot of little fun things you do if you're like into animals. So, if you don't like to do that, then you can also, go to a dog park and
Okay.
spend time with the dog. It's just little things that make you happy. That's what self-care is about. Things that make you happy, things that you want to put to the side just for you. So whatever makes you happy and smile, that's self-care. That's what makes you happy. Music, okay, you have a DJ room, or if you have, like if you're into art, you have a craft room, you want to do something artistic, you want to go paint with a twist, or you want to invest into, things like that. So
Okay.
it's
So
whatever make you happy.
So it's knowledge of self, and I mean that in its loosest term, knowing doing things that make, like you said, make you happy, things you don't want to enjoy.
Yeah.
Some people are introverts. They don't want to be in public, but they like to read a book. They got to, they might binge on a TV show, their
Yeah.
favorite
Join
movie.
a book club if
They
if you into books. Or if you like to be by yourself, then do it by yourself. But if you like an extrovert, then go to a book club. They have a lot of book clubs out here. There's one in downtown, there's one in Akoi, there's one on Sand Lake. There's book clubs. And if you don't know where to start, look them up.
okay,
There's book clubs that you can do. And if that's something self-care for you to, do that. Me and
okay.
go talk about the book.
So pretty much staying active, because they do say, or the saying was that an idle mind is a devil's workshop. So staying active, occupying your mind. Also, one of the things that I found it helps me is accountability, accountability person.
Mm-hmm.
And that's somebody that, it's not that you tell all your business to, but it's somebody that, if you say, hey, we're going bowling Saturday, they're going to hold you to that.
Yeah.
Hey, so we're going to go bowl, whatever the scenario is, but you're accountable to each other. And that opens up, because an accountability partner has to be completely available 24/7. There's accountability partners that, you might wake up 3 o'clock in the morning, you had a bad dream or something, and you just need somebody to talk to at that time. So it's good if you could find somebody like that, Mr. 90 Days, I'll see you in the building. If you can find somebody like that, you can call anything. It's like, I always vision it as like you're drowning and you're reaching, and you're just reaching for a lifeline, and you don't care if it's a stick, a rope, a net, 3 monkeys hooked together, somebody took their belts off, whatever it is going to save you and pull you up. That's what you pull up on. And so, because there's been some times, believe it or not, some
Yeah.
things got rough for me, and I was like, but when God has his hands on you.
Yeah.
That's when the attack is going to come. But he's always going to make a way for you to escape that, as long as you stay first. So accountability partner is something that I would recommend. Anything else you want to tell the people in reference to things that they can do to stay out of bad mental health?
Bad mental health? What do you mean by that?
Things like okay, somebody, is that the noise in your phone or something? Is somebody's clicking? All right, it's gone. So like we talked about going out, going out with friends, doing things like that, dealing with talking to people, take up a relaxation practice, like you was talking about, get a hobby, things of that. Was Mike feedback? All right. My Caesar's my technical guy there. Okay, we all good. All right. But things of that nature definitely will help. What are some other things that you can do? Like, do you have anything you wanted to add to that, as far as what other things you could do? Vacationing. I'm just trying to think of things that it doesn't so much. We're not trying to forget about the incident. We're not trying to get away from them, but
Mm-hmm.
we're not letting it consume us, so that we can find the time to deal with it. And I've just been reading a lot. I'm not trying to get on here and be like I
No,
know it
you're
all.
good.
Yeah, but I read a lot, and I deal with it. And even Brooke and I have talked in the past. I remember when she was going to school, I was like, hey, let me get your book. I want to read the book. I want to, I'm interested in that, because number one, self-preservation, but number two, when you're a people person, You know, I'm just the type of person, I don't like to see anybody hurting. I don't like to see anybody
Yeah.
going through, and you know, yeah, call me an old softy, old teddy bear, whatever you got to say. But you know, I just don't feel like, you know, nobody should go through this life lonely and suffering and things like that. Lakai Holmes says she started creating candles for that reason. So she said, get a hobby, something that you're passionate about. Okay, thank you, Lakai Holmes. That's good. I told y'all that I was going to do something, and I'm really hoping that you're enjoying this. So what I want to do, Chanel in the building, I need my hair done, girl. What I want to do is I want to set it up to where Miss Bishop will come back. Not that we leave right away, but I want her to come back, and I want her to actually take you through. She did a presentation one time, and then break it down in steps about mental health awareness and things of that nature. She has a great presentation. We'd love to have her back. If you like what you're hearing, give me a heart or some flames in the little symbol when y'all send them up. If you wanted to come back, if you would love to her to dig a little deeper into mental health awareness, some of you can even I see one. Okay, some of you can even put stuff in hearts. All right, there we go. People out there need help, but it's not so much that they don't know where to go. Sometimes the help is not available. Sometimes
Yeah.
you get too proud, or I don't want nobody to know I'm suffering. But see, you're killing
Yeah.
yourself. But we're gonna get her to come back and really break it down and do a presentation for us. And let me say this, and I'm getting ready to do my big reveal. So those of you who tuned in, you get a chance to see it. But Pop's Gems ain't going nowhere. Pop's Perspective is a segment of Pop's Gems. Pop's Gems ain't going nowhere. And it pressed it on my heart. So what I'm going to do now is my cameraman is here. Y'all bear with me while I flip the camera around, because I want you to be able to see this presentation. So that being said, and well, before we even do that, because we're about 20 minutes out, but let me wait on that a second. I want to talk about something else. Brooke, so would you say that sometimes hidden mental trauma of childhood experiences can resurface and cause depression and cause inferiority complexes and things of that nature?
Yeah, you saying, so you're basically asking me, like, if they experience some type of trauma in their childhood, could that affect their adulthood?
Yes, that's the
Yes,
question.
that 99% of the client's trauma comes from their childhood, from the experience that I have experienced. I can't speak on other people's experience, like, but at least 99.9% of them have trauma now, and it's been exposed from their childhood, maybe adolescence. But yes, a lot of them have experienced a lot of traumatic experiences, and they're unresolved. So dealing with all that trauma growing up, and then when you get adult, you're not able to cope with it, or you're not able to, talk about what is trauma. So yes, I want to say a lot of individuals that I have experience with in the treatment center that I'm working with, a lot of it comes from their childhood. Not to say that it doesn't happen in your adulthood, because trauma can happen in your adulthood as well. But a lot of its foundation comes from their adolescence or their childhood, and not realizing how to cope with it or getting help for it.
So what would you recommend? Excuse me. What would you recommend as a course of action if somebody like in relationships, they keep getting bad relationships, and it's because when they grew up, that's all they seen. What would you recommend they do to kind of have breakthrough to deal with that childhood trauma so that they can live a normal life? Because if not dealt with, they're gonna carry that to the grave, and then it's going to inflict on the kids or their surroundings. What are some of the steps they can take to kind of break through that traumatic experience of the past?
Well, first they have to be willing to want to get help. So if they're willing to, I mean, not everyone, everyone has their own time frame when they're ready to want to seek out for help. So first they got to
Okay.
be willing to want to get help first, and wanting to talk to someone, or they counselor or a shrink or a therapist, or however, people want to call it. But first they got to want to get help first. And then once they're willing to get help and they're not in denial no more, then, we provide referrals, network, research, See if they have insurance first to see if they can, you know, afford to pay out of pocket. If not, see if that company has insurance. It's all about word of mouth, getting out there. And then if they feel comfortable, then of course, then they seek out, see a therapist that they find, or a psychiatrist or a psychologist. Or probably go to support groups. They have victim support groups. So if you don't want to go through all that somewhere that's free and you don't have to spend no money, they have a victim support groups here in Orlando. So if they wanted to go there, then they can do like a support group for victims that experience trauma. And they have treatment centers specifically for trauma, but if they don't want to go all the way out to do therapy or going out for treatment, then they can go to like a victim support group and
Okay.
go to like a support group to get help.
Okay. Cool. So yes, that's important. A lot of us are walking around here with extra baggage,
Yeah.
and we never unpack it. And then what happens is you take that baggage to the next relationship or to the next stage of your life, and you never unpack it and never unpack it. And then, like I said before, pressure bust pipes. One day, you just explode, or you wake up and you're not living the life that you really want to live. You'll find that you've been in denial so long, you come to yourself, if you will, using a biblical term. You just come to yourself, and so many people endure mental anguish. There's so many, and I'm gonna do a show on this. There's couples that are together, and because of the trauma that one had in the relationship, they abuse the other one mentally, and that pressure is compounded to the extent that the one that's getting the abuse takes it misidentifies it as love, and they care about me, and then they get complacent because they don't want that person to leave, and they'd rather sacrifice their own life. And I've said it to well before, if you're living like that, you're not living your life, you're living a life for somebody else. Because if you're going through that kind of struggle, that kind of anguish, and that person is putting it on you like that, and you accept that as a norm, that's when I think you do need to seek out some support.
Yeah.
Unfortunately, everybody ain't for everybody. That's why they say be careful when you go to join up, because you don't know what you're getting. And there's a lot of relationships that I've experienced in my age coming up, that the woman stayed there because it was, oh, I want my kids to be with their daddy. And they was, and this is not bashing men, because women do it too, but they was getting cheated on and mistreated and dealt like, like there was a stepchild, if you will, and very, very hard pressure. But for fear of losing that individual, or losing whatever that individual brought to the table in that aspect, they endured that. But I'm here to tell y'all, you don't have to do that. I'm not saying leave your relationship. I'm saying value your life. If you can work it out and be with that individual, then hey, to God be the glory. Fine. But sometimes people got to heal together. They got issues, you got issues, and you recognize that, and you seek out, and for the sake of really making it work, you'll get that help. And Brooke is one of them people that she's, like you said, she's been doing this 5 years, so I'm sure she got stories on top of stories to tell, but she can't because of patient confidentiality. So she can't name names, but I'm just saying scenarios. But seriously, my brothers, my sisters, ladies and gentlemen, boys and girls, mental health is nothing to take lightly. We only go around this thing called life one time. And I want my legacy to read, he was happy, he enjoyed his life, he lived it to the fullest, not like, he lived such a hard life and this, that, and the other. And there's so many people that they accept that there is better, there is different, there is hope. You can be happy. Sometimes you can be happy by yourself. You're just scared to step out on your own and really experience life. And then when you resonate, when you send out that kind of energy into the universe, then the person or the individual that is on that same wavelength, you'll resonate with them. See, the thing is, sometimes you join together, but you're in different frequencies. There's some things you like, this, that, and other, but you're not really all the way there. So when you get that individual that's on the same wavelength, and you both want help, and you're both open to each other, it makes for a lot better union. And that's not restricted to relationships. That could be in your work ethics, that can be in with your siblings, that could be with your parents, anybody that you have a relationship with. If you really want it to be healthy, you have to be careful that you don't allow what's going on in your world to be cankerous to somebody else. And that comes from, I mean, it takes a lot to really admit that. And I'm sorry, I'm running at the mouth, but I remember when they had, I think it was the Alcoholics Anonymous, that's what it was. And then you went in and you say, hey, my name is Pops and I'm an alcoholic. And, you know, but just that point was step number one. And I think the biggest problem is that people don't want to admit that they need help. I don't know if it's shame, fear, pride, whatever it is. But the purpose of this show is to let you know there's people out there. Brooke's a young lady. You know, she has her finger on the pulse of the age bracket, but she's been gifted with knowledge that she can, you know, deal with older people. But don't ever think that you're too young, too old, too tall, too big, too broke, whatever the scenario is. There's people out there that are willing to help you. But you got to ask for the help, or you got to at least come to terms that you need the help. So it's very important. In closing, because we're about 13 minutes away. In closing, what would you recommend to the followers, to the viewers that are viewing? What would you recommend would be a good starting point? I mean, of course, you know, accepting the fact that you have a problem, but what are some steps you think that they could take to kind of figure out, you know, hey, do I, you know, is that really me? Is that really how I am? What practices do you think they could implement to kind of see if they're a little off? We're all a little off, but
that's a good question. But normally when people are a little, well, you want to say off, but are acting different, you know, normally it affect their like their functional like abilities to do like daily tasks. So like if someone is acting off, it could be because they went through something, and that's typically okay if they're going through something. It's just how they cope with it. But if it's affecting them to pay bills, affecting them to go to work, affecting them to go to the grocery store, affecting them to be able to like do the daily tasks that we need to do as like, you know, living citizens, then that's when they need to notice like, I guess I do need to get help. If it's impaired, like if it's affecting those type of things, that's when you should want to like reach out to say like, okay, I think I do need some help. But inside, they'll know if they need help just based off them. They'll know like they're different. Their mood is different. Like they don't feel themselves. They don't know when the last time they've been happy. So like only you know when you're acting off, and other people can see it as well just by the signs. But you are the first to notice like when you stop doing the certain things that you used to do that you don't do no more, or like concentration and like difficult doing this or unable to do that, or you know. So you are the one that noticed first, and then others start to see things afterwards. But you can also do some research too about it too. Research it or find a friend that you feel comfortable with and talk about it. See if that you feel comfortable sharing what you're going through, because a lot of people like to keep it inside. But if you can find that one friend that you're comfortable with, then maybe you can share with them and let them know and say like, hey, I think I do need some help. But I know it's like it's a stigma in the African American community. So at least 95% of my clients are Caucasian. But I mean, yeah, in the African American community, it's not that many of us because we
we,
don't, the
yeah,
stigma, you know,
yeah.
we don't really believe we have a problem.
Right, right. Well, let
So,
me say this to those who are following, and I know it's not y'all, so share this with somebody else, but wake up, people. Get off of that high horse. You can live a better life, even if you're living your best life now. You know, and I'm saying this, if I'm wrong, correct me, but a lot of the people that have the most problems are not broke people. I mean, you talk about people that got money, people that are well-to-do, and they just fall into depression. So don't think that, there's some folk out there that are doing well. You trade your life in a minute, but internally they're distraught. They're that keeping up with the Joneses and staying on the cutting edge does something to you mentally. It's not for it's not for the average person. But what I really want to stress is that we as a people, African Americans, we need to get a grip, because society is putting so much pressure and creating so many stereotypes and setting the bar so high that African Americans are losing their mind trying to meet the mark and be somebody else. Live your life for you. set your standard. It's okay to be competitive. It's okay, you know, to want to be at the top of the whatever it is. But by the same token, at what cost? You know what I'm saying? There's people that have climbed to the top of the ladder and they're lonely. They say they're lonely at the top. And so don't think it's just, you know, people that are depressed or broke. I think that the problem with, or one of the issues with the African American community is that we don't want to lose face. We don't want, you know, we want to have it all together. We want people to think, you know, we got it all under control. And so that they won't come forward. So hopefully something that's been said, something that Ms. Brooke Bishop, we thank you so much for giving of your time and coming on the show. Something that she has shared with you. We're gonna have her back, and then she'll give credentials, or not credentials. She'll give locations and some helps. Of course, suicide hotlines, all that thing. We'll have that number. Let me tell y'all something. It's your life you're saving. Don't get so complacent that your pride takes you to the grave or takes you to deeper in distraught, because the deeper the hole you dig, the harder it is going to climb out of. Grab that rope. Let somebody pull you up. Okay, so thank you. Now, I told y'all, I said to everybody that I had a very special presentation. My cameraman's here, so we're going to flip the screen, and he's going to hold it up. So I want to show y'all a little something, and that God put on my heart to get done. And some of y'all seeing it, real close ones. But at this time, I'm gonna go ahead and get my man Lefty. So if you see the camera shaking, I'm doing it on purpose. And Brooke, again, thank you so much. We want you back. We're gonna bring you back. Don't go nowhere. I'm just saying. But we're gonna bring you back so that we can talk some more about mental health. For those of you that want to contact or find out where you can get help from, I'll get some information from her. I'll start posting it in your local area, so it'll be like like national things that can come about. Because if you're not in Orlando, you won't have access to this mastermind. But because we got people, again, we international. We got people all over, so people all over need help. So bear with me right now. We're gonna flip the camera, and then I'm gonna do this little presentation, see how y'all like it. You got to keep me connected. You cannot connect me because they won't hear me. Let me just put it on. Not yet. Open it. Oh no, I'm gonna drop this so I can. Let me drop this one. You could actually zoom in on it too. You know that, right? All right. Can y'all hear me? I didn't mute myself. All right. Here we go. This is something that I had. Pops Gems ain't going nowhere, baby. The 101. This is official. We had it made. Let me see you in the chat what you think. Let me think. That's right. Or like the kids do. Real tissue. We committed to this. Now, I said that to say, when I say I ain't going nowhere, it's not from a braggadocious standpoint. God has put this show on my heart to reach out and help people. And it shows like this with Brooke. It shows like this that we have people come on and give their lifestyle, their experience, their share, their information. So with your support and prayers, God's anointing will be able to continue to do these types of shows. We're about 5 minutes before the end. Again, we want a big shout out. Y'all give me some hearts and some fire in the thing from Miss Brooke Bishop. Show her you appreciated her, giving her time, her knowledge. Those of you that tuned in especially for her, you're welcome to follow. We appreciate that, each and every one of you who have taken time and thought it not robbery to spend a little time with Pops. We're plugging. I see the hearts. I see the fire. She's a cutie too. Watch out though, because I got 9mm with hollow points. I'm sorry. I was just thinking out loud. Coming up in January, because or actually on the 18th, I got another guest coming next week. I'll solidify that. But on the 18th, we're doing our holiday giveaway. And what I'm doing is I got a bunch of my past guests and everything. We're coming together. I believe Caesars is going to give some things. I got some other people that can give some things. And we're going to spin the wheel. We're going to spend that show just giving away, blessing people. I have some candles. I got some books that we're going to be giving away. So that's the 18th. Don't forget, on Christmas Day, we're just going to pop in, tell everybody Merry Christmas. For those of you who celebrate, those of you who don't, we're not going to have a long show. We just be on for a few minutes. And then coming in January, as I said, Pop's Gems is the umbrella. Pop's Perspective is one segment. But I'm coming up with a thing called The Vault. It's a segment called The Vault. What do you keep in vaults? Precious and expensive items. So we're going to open up the vault, and we're going to have some gems dropped. I may bring in special guests, or just Pops will speak to you from the heart. So that's going to be the vault. Also, the Couch Chronicles. We're going to open up and do some pre-recorded Couch Chronicles. And what I mean by that, and there's nothing new under the sun. I like the way 85 South had the couch. For those of you who watch them, but we're going to set up the studio where I can bring in guests. We'll pre-record it. You'll see clips, but we're launching onto YouTube. So you'll be able to go to YouTube and see the whole episode. You'll be able to see the whole clip. These shows will be on there as well. So keep that in your mind. And then we're going to Spotify, so you'll be able to hear the audio portion on Spotify. And we're working on that for January. And then I want to do something that God put on my heart. It's going to be the thought of the day. It's an inspirational thought. I got a very, very good friend of mine that's going to come on, drop a couple nuggets for you to meditate on. And we want you to do it like the cow chewing syndrome. For those of you who don't know, when cows eat grass, and they call it cud, and they chew it up, they swallow it, and then after a while they regurgitate it and chew it on it some more because they want to get all the nutrients out of it. So with this motivational thought, I don't want you to get that thought of throwing up out your mind, but you'll get the motivational thought in the morning, and then throughout the day, you can just reflect on it throughout the day and help you carry you through the day. It's going to be very spiritually based. And I believe that there's even in the universe, what you put out is what you get in. And if you key your mind and keep your mind free of negativity and focus on positive things, then you'll resonate with other positive things. We're about 2 minutes out. Again, I want to thank my cameraman, Lefty. Showed up a little bit late. That's okay. We're not mad. Things happen. The equipment, we're gonna pray over this. It's gonna be all right because we still had a good show. The devil can't stop this. My guest, Miss Brooke Bishop, thank you so much.
Thank you. Thank you
much
for
love
having
to
me.
you.
Appreciate
And for those of you that want to hear more, stay tuned to Pop's Gems, Pop's Perspective, because we got a lot of great shows coming up in the future for that we can all benefit from. So that being said, without further ado, I want to bid you a good night. I know we're off a little bit early, but I got a lot on my mind to think about. This show really brought a lot of things in perspective for me. I hope it's done the same for you. Till next week, thank you, you, and you. And remember, God loves you. The higher source loves you. The universe loves you. It's time to love yourself. And when you open up and you start loving yourself, the world will be a better place, because then you'll start caring about one another. You can't care about somebody else if you don't start caring about yourself first. This Pop's Gems, Pop's Perspective. We in the building, baby. We out here. Y'all tune in next week. Peace.